morning. I am Dr. Pradeep Nayar from Fortis Malar Hospital. I am a senior interventional cardiologist. I just want to tell you a little bit about cardiac problems during COVID. Now we are in the midst of the second wave, and this seems to be a more vicious wave than the first. We are seeing a lot of positivity rate here now. So those who have cardiac disease should be very careful in maintaining social distancing and putting masks and washing your hands regularly, because if you have cardiac disease and if you get COVID infection, then the chances of major cardiac problems are very high, because this virus not only damages the lung, it can also damage the heart very badly. Second, we have the vaccine now. So those who have cardiac problems, it is safer to get the vaccine. There are some small side effects will be there, but that is nothing to worry compared to getting a COVID infection if you already have heart disease, because then the mortality and morbidity is very high. Therefore, I request all of you, advise all of you to take, those who have cardiac problems, definitely take the vaccine as early as possible. You don't need to stop any of the drugs that are usually given for heart disease. There's no worry, you can take the vaccine. Then, if you have cardiac disease, whether it's COVID times or not COVID times, ideally once in a year you should get a complete thorough cardiac checkup, including a treadmill test. Because that's the only test that will pick up any blocks before it has caused damage to your heart. So this is my sincere advice. Follow COVID guidelines, get your vaccination done, and get a yearly cardiac checkup, including treadmill test. It's very important, treadmill test every year if you are above 40 or you already have existing cardiac. There's a lot of apprehension among cardiac patients that if they are taking blood thinners, they should not take the vaccine or they should stop the blood thinners. The blood thinners that are usually given for cardiac patients like aspirin, clopidogrel, prasugrel or ticagrelor, these need not be stopped. If you're taking anticoagulants, that is warfarin or acetone, they need to be stopped or at least temporarily withheld before getting the vaccine. But all the usual cardiac blood thinners don't need to stop at all. Please go ahead and get your vaccination done without any hesitation.